Welcome along everyone to this Winslow Constructors Health webinar in conjunction with the Barwon Health Foundation. My name is Francis Trainer and I'm the Philanthropy Manager with the Foundation, and I'm delighted to be your host this afternoon. Let's start by acknowledging the traditional owners of the land. We, the Bowman Health Foundation, acknowledge the traditional owners of the land, the Wadawurrung people of the Kulin Nation. We pay our respects to the elders both past and present. We thank the traditional owners for the custodianship of the land and celebrate the continuing culture of the Wadawurrung people, acknowledging the memory of honourable ancestors. We also welcome all Aboriginal and Torres Strait Islander people joining us for this webinar this afternoon. And a special welcome to everyone from Winslow Constructors, both joining us live for this webinar, and also to all of you watching the replay at some point in the future. It's great to have you all on board. Winslow have been great supporters of the Bowman Health Foundation and by extension Barwon Health, and their amazing support has gone a long way to ensuring the best care of patients at our health service. Not only are Winslow generously supporting their local health service and those in the community who require treatment at some stage, but importantly, they obviously have great care for their staff to try and avoid ill health by conducting these health webinars, and I think this speaks volumes for the quality of the company and the people behind them. One of the big events that Winslow support the Bowman Health Foundation with is the annual Run for Geelong, which is rapidly coming up just a few weeks away on Sunday, the 15th of November. And although restrictions are easing a little with COVID, the run will be conducted in a slightly different manner this year. And later in this webinar, we'll hear from Danny Flowers, one of my wonderful colleagues here at the Foundation, and Danny will let us know all things Run Geelong and how you can get involved. This is the final in the series of Winslow Constructors Health webinars, and I'm probably not allowed to say we've saved the best for last, but I'm delighted to have with us today a wonderful, charming man whose responsibilities involve caring for our healthcare heroes. Now, if my memory of history serves me correctly, Vienna, the capital of Austria, has given us Mozart, Beethoven, and one of the most famous medical minds of all time, Sigmund Freud. Why am I telling you this? Well, it's also given us another great medico. Please welcome our special guest this afternoon, Manager Occupational Health Physician Staff Cate, Dr Rudi Gasser. Great to have you here, Rudi, and thanks for joining us.
Thanks, Francis. Yeah, it's a bit overwhelming, the introduction, but there has been a Nobel Prize winner up on the University of Vienna with my surname. Unfortunately, it was about 100 years ago, so it wasn't me.
Right.
But certainly very proud to be Austrian and having gained my medical degree there. So
well, tell us
I
about
was lucky
that.
enough. Yeah, sorry.
Tell us a bit about that, when and where you got involved in medicine and how you arrived in Geelong.
Well, it's a long story, but I studied medicine in Vienna and funded my medical degree by working as a ski instructor in the school holidays and in the semester holidays. And as one of those semester holiday jobs, I met my then Australian girlfriend, now my wife of nearly 50 years. So typically when people say, well, why did you end up in Australia? It was a love that dragged me here.
And you've been at Bowman Health how long?
I've been at Bowman Health for 21 years, and
Wow.
In Bowman Health for 21 years. I started there in 2000. I've seen the greatest evolution of a regional hospital, has just amalgamated with other services around. And of course, it has in the meantime grown, got a medical school, it is a university hospital, enormous health service developments that, I mean, if I remember back of what I saw then and what I see now in Barwon Health is just an amazing change over those last couple of years. And I guess it's a typical regional supporting the health service of the community, the fundraising. It really is the center of health in town, which is it's a great feeling.
Yeah, indeed.
The other thing, while we talk about an engineering organization, before I came to Bowman Health, I worked for 17 years and I ran the staff health service for a telecommunications engineering company called Ericsson I looked after the staff for about 2,500. So I'm familiar with the engineering minds and the engineering focus on things. I also am aware of, when we talk about health, I think I just want to raise that it is the most valuable asset we own. Unfortunately, we take it for granted. We only notice it when we miss it. And I have been trying, both in my previous job and now in Barwon Health, of trying to get the staff to work at their best, realizing that the health and well-being of the staff isn't just a feel-good story for them. It determines the quality of care, the quality of service that they're able to deliver, because ill health leads to mistakes, leads to poorer health outcomes for the individual as well as for the organization that you're employed in. Most organizations are focusing on the workers' comp injury, the workers' comp costs and work-related injuries. That is nothing in comparison to the real health cost of illness, absenteeism, early retirement, health-related retirement, for people who are trained at great expense and great time involved, and then all of a sudden they are very hard to replace. So looking after staff, like your organization is doing, is really leading by example, and actually doing, not only talking about our people are the greatest asset, you are actually doing something constructive for them.
Yeah, it's a great message. So as you said, your special interest is staff care and wellbeing, preventative health and health promotion. What exactly does that involve? What's your work week at Bowman Health look like?
My work week in Bowman Health is really, that's why, even though I've been 45 years in medicine, but every day is a new challenge. Every day is a new opportunity to assist someone, to assess things, and actually put people, and I think that will be the message for you as well, that every contact with a healthcare provider should be an opportunity for health improvement. Don't just have the fix. If I talk to an engineering company, I know exactly what they organize for the routine preventative maintenance of any equipment that they use, because you know that if you don't do that, it is actually going to fail at some stage and lead to problems. Now, when it comes to the human being, to your staff, it should be exactly the same way. They need to look after their health and well-being, preventatively looking ahead, because what we're about is that they are able to enjoy their work life, but also be productive and not affected by ill health.
So over the past few weeks in these webinars, we've been dealing with subjects like cancer, heart health and mental health. So obviously big health issues. But today you're focusing more on good health. So what does good health mean, and how do we achieve it?
Yeah, so good health, the definition of good health is by the World Health Organization, the physical, the psychological and the social well-being. Now, I know you've actually addressed on the physical front cancer and heart disease, but it really is any acute or chronic illness or injury that is affecting the physical injury. Now, the psychological injury, you've also addressed on the mental health webinar that you've been running. And what people forget is the social well-being. The social well-being is really about connection, your partners, your family, the extended family, and your working life. Now, what I'm always highlighting is how the physical, the psychological, and the social is interconnected. They all have an influence on each other. If you imagine that you have a relationship problem, if you have a problem with a child, if you have a problem with elder care, how do you sleep? How is your appetite? Everything is really connected and affected by it. And I think this recent COVID lockdown of 6 months, even the healthiest people with a great resilience were affected on all three fronts. They actually had some physical symptoms, the psychological, burden you could actually see and feel. And I guess the social well-being by being together at home and homeschooling with children and all the other things where we are not allowed to do our things has a direct impact on our health and well-being. So lucky that, I mean, this is something that lots of my medical consultations are for people in such crises, family crisis, children with drug addiction, elder care where they don't know how to look after people who, as they are falling off on the other end of their life scale. So I think this just shows when we actually are trying to look after our health, we need to keep an eye on all those three aspects, which are really relevant and important.
Rudi, what sort of general health maintenance should we consider?
The general health maintenance, so just like talking about the machine, the first thing is for your machines, you have a mechanic or you have the service department that's actually looking after the equipment. For us as, even the health care workers find it very hard to actually find a good general practitioner. They will be helping you to actually navigate you through the various ups and downs on the health front through your life. Have a crisis plan ready. People see no other way out, and all they do is, some self-harm or some other silly things. Have crisis plans ready. So just like in your work, that's what you actually plan for. And I always encourage people to use a reliable health information. Now, the internet is full of health information, but all sorts of terrible sources. Use the Better Health Channel. It really is a first guide to actually guide you home. But as a start-off message is, if you've been sitting on some symptoms of concern, whether that's a lump or a bump somewhere, and you just didn't get around to do anything, a mole on the skin, reflux or any other symptoms that you just keep on waiting, it just doesn't go away. You feel so much better if you actually go and see your GP, talk about it, and it is just as a reassurance that I'm going to be fine. Because especially my clients, they are healthcare workers. They're the last thing they do is actually go and seek some professional help. But do so, you feel relieved and better afterwards. And as they say, denial ain't just a river in Egypt, because we live in a denial. So when we participate in routine government screening programs, so like the bowel checks, the prostate checks for some people when indicated, women's health check and pap smears and mammograms, eye checks, hearing when necessary. I'm sure you do that with noisy equipment, regular dental care. Those are just the routines. Do them on a regular basis. I can talk about, I normally participated in the bowel check, and it comes in the mail and it's lying around. They're going to do it tomorrow and they do it later, and then all of a sudden you've just forgotten about it. And I was personally caught up myself like that. So 1 year didn't do it. That means I had a 4-year break between one test and the other, and just very happily enjoying my holiday and getting a phone call from my GP of saying your bowel screen has come back with a positive test. So just do those programs, because you've heard about cancer. It is about early detection and early intervention that will actually save us and will actually make things better. These programs are for you, for all of us, and don't fall for the trick of just think that is it can be postponed.
For those sorry, go on.
Yep. Now go ahead. Just every contact with a health practitioner should have that opportunity for trying to look at the risk factors. And the risk factors, you've already heard about heart disease and cancer and everything else, but it really is about how can we deal with the risk factors in a prevention on the long run, so that we actually feel that we are looking after our most important machine, which is our body.
For those of us just joining us, our special guest today is Dr. Rudi Gasser, and Rudi has come in on a phone link. Unfortunately, couldn't get the Zoom working. He's a very handsome man, so maybe in the replay we'll have a photograph up for you, Rudi. But Rudi, can you tell us what's lifestyle medicine? What's all that mean?
Well, lifestyle, I think lifestyle is medicine and medicine is lifestyle. So you'll come out on the prevention side. I listened to a very interesting presentation once in my conference visits by Dr. David Katz in the US at Yale University. He said the things that matter is the 3 F's and the 3 S's. So F stands for feet, fork, and finger. And the S stands for sleep and stress and love or sex. Now, when he was actually talking about this, so feet is really just an expression of physical activity. Physical, the more active we are, the better shape the body will be in. What we do on the forks, we are what we eat. So if we are actually not following the guidelines, and those guidelines are very simple. Eat plenty of vegetables, plenty of fruit, fish, as much as you can afford, and lean meat if you are a person who actually eats meat. But overall, you follow those simple things. There is no great science. You don't need to run around and try to things. Now, when it comes to the fingers, Francis, what would you be thinking of what we can do with the fingers we need to be keeping an eye on?
I don't know. I'll say fingernails.
Yeah. So smoking, holding a glass to drink. So those are the things that actually, now smoking is the greatest contributor to the burden of disease, not only in this country, but worldwide. So if anybody on this listening audience is still smoking, please consider, in the interest of your best health outcome for now and the future, to actually stop, because there's help available and you can actually put this risk factor under control. So please consider that. With alcohol, it comes down to also drinking in moderation. Moderations, at least with alcohol, people are fully aware of the standard drinks. So really we're supposed to be keeping no more than 2 standard drinks, but I know that that is sometimes a bit of an issue, especially in celebration time. Now, sleep is most important. We know how many accidents occur by people being tired, fatigued, either lack of sleep or poor sleep. So there's lots of things you can look up at the Australian Sleep Institute. There's lots of strategies how to deal with this. Stress in life, it really comes down. Look at the stress, identify the stressors, change the stressors if you can. If you can't change the stressors, change your reaction to the stress, because it's no use of sitting when you're late, sitting in front of a red light at the intersection. Whether you are upset about it, the light is not going to change any sooner. So change your reaction to that. And then the last one, sex or love, it really comes down. We are people who actually want to share life with other people. We are actually important it's important to look after those relationships because they mean a lot to us. It is about mutual, rewarding and satisfying relationships that really adds a lot to our things. So if you have those lifestyle factors that we just talked about, if you're diagnosed as a type 2 diabetic, the first thing that the doctor will tell you is get more active, change your diet, don't drink too much, don't smoke, and follow exactly the same lifestyle stuff that we are doing here. So one, it's on the prevention side. The same thing is if you're diagnosed with high blood pressure, the same basic lifestyle factors are going to be addressed at the same time, because this is much more effective to actually address those health problems than medication, which sometimes is still necessary. But the first thing, that's what you do.
That's feet, fork, fingers, not fingernails, sleep, stress, and love. That's great.
Yeah.
Now, Rudi, how can we plan for a future with a purpose?
I think some people just sort of live from day to day and week to week and haven't really got a plan. So what their life is about. Now, in a work situation, they would very clearly map out and see what their plan is for this quarter and the next quarter and next year. In the roadmap out of COVID, we had a plan of trying to actually sort of at least be looking forward to some things to happen. Sometimes it's also good that we actually reflect on our own life, our plan for the life. And the plan should really be about what we do in a professional career, what we do in our personal career, what makes up life, like hobbies, art, culture, everything else. So what we want to do is we don't want to lead a boring life. So firstly, we said we want longevity. We want to add years to our life, but just adding years to our life when it really is just a meaningless or a very boring thing, we also need life to the years that are in front of us. So we can really enjoy life, make the most of our surroundings, the achievements we achieve at work, the achievements we have at home with our family and everything else. So there are many wonderful things that make life such an interesting thing. It really comes down that we should treasure those social interactions, the social interactions at home, the social interactions with the family, the community, give back to the community like you're doing with your community action of trying to support the Bowman Health Foundation, which we're really grateful for. But overall, have fun, enjoy life. Every day you got out from your bed in the morning, you're able to get going, is a good day, because unfortunately we see people where that is not possible.
Rudi, when this world-changing virus started to make headlines at the start of this year, there were naturally some very grave concerns about how we'd all be affected, and the Executive Director of the Foundation, Zoe Waters, asked you to talk to our Foundation staff and talk through the implications of the virus. And I must say, your manner and knowledge certainly alleviated a lot of concern. So 8 or 9 months down the track, we're in a remarkable position compared to a lot in the world where we've got, almost squashed the virus, at least for the time being. And Barwon Health's contact tracing team has done an amazing job and a crucial role in keeping the numbers down in our region. We've heard of the race around the world to find a vaccine, and Bowman Health are also playing an important role on that level with clinical trials underway. If you look into your crystal ball, just very quickly, because we are running out of time, but how do you see things panning out from here in Australia?
I guess this has been an unusual, and really nobody knew what's coming. And I think looking back of where we've come from, so we are involved in testing our healthcare workers for COVID. So we've tested about 4,500. We had some positive tests, but they've all made it through and have recovered or are recovering. So Geelong region G21 hasn't had a positive case now for about 5 weeks. So we're in a wonderful position, but I think we still need to be vigilant, because I guess it can always escape again. I think overall we've done remarkably well in comparison to what you see now, what's evolving in Europe and USA. But I think the only assurance will be there will be a vaccine, and we just hope so that you hear from various sources that it's coming around soon. But there's no guarantee for it, so we might have to live with some of those restrictions for a while. I think wearing the mask, we already got used to it. I used to wear them in my surgical years, but that's I did never expect that I'd be walking around on the Anglesey beach with my surgical mask on the face. This is a unique and once in a century event, and I think nobody really knows what happens. So for me to predict, I think we're in a great space. We just need to keep at it and really be vigilant. And we had a wonderful contact tracing team locally. So when we had maximum about 200 active cases in this region, to get it all down, all sorted, and isolate the people so that they can't pass on the infection to others. I think that will still be the question for a while.
Yeah. Well, Rudi, Vienna might have had Mozart and Beethoven. We do have Andy Popjoy in the piano bar and Dr. Gasser. So Rudi, you're certainly one of Vienna's finest exports to Geelong, and we're so grateful for your insight and your time today. Thanks so much for joining us.
Thanks, and all the best to the staff of Winslow, and I hope that this has been of some help. Please take care of your health, treasure it, and look after it, because if you don't, you are going to be the person, and your family is going to be the person who actually is going to miss out on that. So please take note of just the simple strategies that we have talked about.
Thanks again, Rudi. Now we're joined by Bowman Health Foundation's Foundation Grants and Project Manager, Danny Flowers. To see Danny there on the screen. You are there. Danny, you've been at the Foundation 10 years, and some of the roles you've accomplished and accomplished so well have included manager of our community fundraising programs, events manager, and now Foundation Grants and Project Manager. You've also been on hand to troubleshoot computer issues we have had in the office from time to time, having great technical skills in that area. But you're here today to talk about Run for Geelong, to be conducted on Sunday, the 15th of November. Now, it's long been one of Geelong's great community events and was enormously successful last year, but 2020 has thrown up a few challenges. So please tell us how the event's going to be conducted this year.
Yes, so with everything in 2020, Run Geelong looked a little bit different. We are holding it in a virtual capacity, so we're trying to still sign up as usual, receive your T-shirt as you have in previous years, Run Loves, and we're asking you to just complete your chosen area close to home, the 100% of your fee still going to Bowman.
So you're just cutting out a little bit there, Danny, but it's a really wonderful community event, and all registrations go to support Bowman Health services, and I understand you can actually select the service you want to support.
Yeah, definitely. So 100% of registration fee goes where you'd like to go. So any service that Barwon Health offers, which is very broad across our community, choose where you'd like that to go.
How do we sign up, and what are the costs?
Yep, so registrations are open now, so you can just go to runforgeelong.com.au. There's a $29 entry fee for adults, $15 for youth, and $8 for toddlers. It all includes a T-shirt.
And of course, Winslow Constructors are again one of the sponsors this year.
Yes, so we were a very sponsor last year, amazing, and board this year, fantastic. We've had a really great partnership now, both with the run, but with a few different events and other programs, which is amazing. Great supporter of the foundation. We're very excited to have them on board again this year.
And is there anyone you want to thank from Winslow, Jenny?
Yeah, definitely. So Kat Stewart are the main driving force behind this partnership. So we're really grateful to those people for pushing the partnership forward. Hopefully 2021 is a better year and start those activations that we've been doing in the past, which have worked really well for our patients and families.
That's great. Thanks so much, Danny. Apologies to everyone for the technical issues. Like Danny's voice is coming in and out, but I'm sure you got the gist of what's going on there. So just repeating, go to runforgeelong.com.au, run numeral 4 geelong.com.au to register now for a wonderful event on November the 15th, and you get a wonderful T-shirt. Have you got the T-shirt there, Danny?
I do actually, one I prepared earlier.
Okay.
There's not the, but it will look very similar. So it'll be the front, and then we'll have all the wonderful supporters on the back who've made the event possible, including Winslow. So they will be available in the next couple of weeks. So if you sign up now, you get one.
Fantastic. Well, thanks again. Now, that was the final in this series of Winslow Constructors Health webinars, which was taking place incidentally in Winslow's Safety Month. And we do thank all the guest speakers we've had over the past month. Thanks very much. Thanks to Danny Flowers for putting it all together. Thanks to Winslow for reaching out to the foundation to arrange these sessions for their workforce. And thank you, of course, to those of you who've tuned in. We hope the information provided with you with some benefit. These webinars will be placed on our website, so you will be able to have a look at them at any time in the future. Enjoy the rest of your day, and remember to stay safe and healthy. All the best. Thank you.